This media briefing number 12 of 2020 on coronavirus status update by the county on the 23rd of June today. Ladies and gentlemen, welcome to this briefing on COVID-19. Today marks the 80th day since the index case of novel coronavirus was reported in Mandera County. That is 5th of April 2020 to date. Our early state of preparedness and mobilization of all available resources, both financially and human resource, as well as planning and rapid intervention, has seen us overcome all odds to contain this dangerous situation. Along the way, we have screened a total of 97,502 people at various points of entry and exit, conducted a total of 729 tests, out of which 18 were confirmed COVID-19 positive. We have quarantined a total of 334 people, including 176 contacts of the confirmed cases and 158 travelers from outside the county. We thank the Almighty Allah that out of the 18 confirmed cases, 17 have been discharged after full recovery, and the remaining one person is only awaiting for validation test result before we release, as he has already tested for the first time negative, and we have sent his second test for validation awaiting results. Across the border in Bulhara, reports of upsurge in COVID-19 cases, as well as within our country at Nairobi, Mombasa, and other areas have been reported. As such, despite the fact that our numbers have gone down from, have flattened, we are not out of risk yet, and there is no cause for celebration other than to start putting even more effort to make sure that we remain protective of the population to the best of our effort as the situation is changing at Nairobi level, and travel restrictions are not getting enforced as required. As such, we are still receiving travelers from Nairobi coming to this area, and also movement of cross-border people is not 100% foolproof. Hence, we encourage our people to adhere to guidelines given by Ministry of Health in terms of hand washing, use of masks in public places, and social distancing, among others. In line with His Excellency the President's directive to all counties to increase bed capacity to 300 bed capacity, with the intention of opening up the economy, we, the county government of Mandera, we now have a total of 190 beds ready and have operationalized 2 standalone COVID-19 dedicated facilities in Mandera East, which is Kamor Infectious Disease Hospital and Mandera Rehabilitation Center. We will procure the remaining 110 beds as soon as possible, and also will set aside the new A&E complex in Mandera and Elwak sub-county for ICU and HDU response to COVID-19. While we have done our best under very difficult circumstances, challenges still remain that hinder our efficient response, and which the Ministry of Health at national government level needs to urgently address. And this include availing testing capacity to Mandera County. Mandera County is 1,200 kilometers away from Nairobi, and on a triangle border where previous disease spillover from neighboring countries have been routinely happening. It is not tenable to send samples to Nairobi anymore in view of cost, and the road to Wajir is replete with dangers of insecurity. The delays in processing of samples sent to Nairobi is also a big hindrance to timely intervention. Case example is the sample sent on the 19th of June via flight, which is yet to be released 5 days down the line. I call upon Ministry of Health and the national government to urgently look into the matter of installing testing capacity expeditiously to resolve this challenge. And in terms of resources, while it was agreed through a special consideration that 850 million was to be given, divided and given to the 4 counties that had been dealing with COVID-19 for nearly 3 months now. That money was meant for Mombasa, Kwale, Kilifi and Mandera. And the money was channeled through Ministry of Health. We still have not received those funds. I would like to appeal to Ministry of Health to release to us these funds in order to make sure that we are able to adequately prepare ourselves as required. The disease burden is weighty as depending on the length of duration that the counties are dealing with this challenge. And the wisdom that gave rise to that decision being made should not be underestimated, and the funds need to be released. Equally, in the wisdom of the National Assembly, after trying to cut down on their costs, they gave 4 hospitals some allocation of funds to deal with COVID-19 and other related challenges. And this money was supposed to benefit Jaramogi Odinga Referral Hospital, Coast General Hospital, Mandera Referral Hospital, as well as Kitui Referral Hospital. And to date, we have not received these funds, and we would like to appeal to Ministry of Health to expeditiously release, because this money has already been appropriated by the National Assembly for and ring-fence for purposes of utilization in their wisdom by these 4 hospitals. This money have not been received. I would like to appeal to MOH to release this money to these counties also. I call upon Ministry of Health to release these funds in full so that we can better manage any upsurge in cases, as the projected peak months are still away as projected and given by Ministry of Health, that our peak month is likely to be August or September. And that means that we have to continue with our response process as required. Finally, let me take this opportunity to thank all those who worked tirelessly to ensure we flatten the curve, especially the Ministry of Health staff who have worked day and night to ensure we contain the situation and carry out very tedious contact tracing. The multi-agency task force deployed to sub-counties, as well as the county coordination team co-chaired by the county commissioner and myself, our security personnel, non-state actors, as well as the leaders of Mandera, people for complying with directives, and the public for complying with the directives, playing their civic duties of staying safe. Ladies and gentlemen, as the people of Mandera, we need to know that it is not yet time to celebrate, and that COVID-19 is here with us, and it is going to be here with us for a long time as a country, as a region, and in the global world. As such, all the measures that were discussed, the protocols and the measures that were discussed must be practiced, including social distancing, washing your hands, where there is no availability of water, but there is availability of sanitizers to sanitize your hand, social distancing, as well as also protecting and making sure that whenever there is opportunity for tests to be carried out, not to fear to be tested, and the public not to stigmatize those that have been reported to be having COVID-19. Thank you very much.